A growing body of research suggests that chronic inflammation plays a critical role in the onset and progression of Parkinson's. And BioVie is one company that is currently holding clinical trials on this. With me is the CEO, Cuong Do, to bring us up to date on this, because last time you were here, you had talked about the new clinical trial you were preparing to launch. So where does that stand right now?
Jane, thank you for having me back. And I'm also happy to report that we have now launched that trial. We announced just last week that we've enrolled our first patient into the trial, and we're now underway to try to enroll 60 patients in this trial.
Okay. And what do you hope to show with the trial?
In our prior trial, patients with moderate to severe Parkinson's given bezisterim and a standard of care drug called levodopa experienced significantly better muscle control, showing that we can help more advanced patients. This trial that we're launching right now, we are giving bezisterim alone to diagnose Parkinson's patients who need to go into therapy for the first time. So this will help us see if we can establish bezisterim as first-line therapy.
Okay.
Right, and if these clinical trials are confirmed, it's proved to be positive, we believe that bezisterim could become the first new therapy for Parkinson's in over 5 decades.
Yeah. So you mentioned you've got your first patient, but you need 60.
Yes.
So how do you get the other 59? Do you work with other organizations, or how does that work?
We do. We're grateful to have the support of the Michael J. Fox Foundation, the Davis Phinney Foundation, and the Parkinson's Patients Foundation. They're all getting the word out about this trial to their members. Right? This is a first new therapy in Parkinson's in quite some time. So with their help, we're hoping to get the word out, and with that, we hope to enroll the patients very quickly.
When do you expect to have results?
Well, if everything goes according to plan, hopefully we'll have top-line data by the end of this year, early part of next year, which is relatively quick.
Okay. And then you're also launching a trial for long COVID. So tell us, where does that stand?
Well, recent research has tied the debilitating symptoms of long COVID to inflammation that works through the exact same mechanisms that bezisterim works through. Right? And that's why we're the only company that has received a grant to test a therapeutic in long COVID. And we're launching that trial right now, and I'm happy to have asked Dr. Penelope Markham, who leads our long COVID program, to join us today to tell us more about that program.
Yeah, let's talk to her now. And with us is Dr. Penelope Markham, who is the head of BioVie's long COVID program. And welcome, Penny. And what causes long COVID? Do we know? How big of a problem is it? Isn't COVID behind us?
Great questions. What causes long COVID? Overwhelmingly, it appears it's chronic inflammation after infection with the virus. And we see in patients persisting inflammation. Normally, your inflammation is there to take care of a bug, get rid of it, and it should disappear. But it chronically persists, and the common theories are that the virus is persisting, or particles of the virus are persisting and aggravating the immune system, or there's an increase in immune cells that are very aggressive in inflammation. And particularly we see inflammation in the brain of patients that are experiencing neurocognitive symptoms or brain fog. So is it behind us? No, we are still, we are still experiencing COVID infections. As you know, there are a couple of waves a year. Infections are milder. We have milder variants now, and people are vaccinated. And those who are at risk with diabetes or hypertension know the risks, and they can minimize their risks. But as you know, with acute COVID, or the infection of COVID, it is typically age is a risk there. Older people have more severe infections. But with long COVID, it actually is a younger population. The average age, they're in their late 30s or 40s. They're at the height of their career, or they are managing children or rearing children. And, the conditions or the symptoms can be devastating to this younger population. There's about 17 million US adults in America are affected by long COVID, 1 million children, and 80% of those children report that their activities are impacted.
Yeah. Interesting. And interesting you mentioned kind of the brain fog, because some of my friends have said that they still feel that.
Very debilitating.
A couple of years later. Now, how could your drug candidate help people with long COVID?
Well, our drug is anti-inflammatory. and it happens to target the pathway, the pathway of inflammation that has been implicated in long COVID. And our drug can cross the blood-brain barrier, and we believe it can get into the brain and target this inflammation. It's also an oral pill, as you know, and it has a safe profile, which means it's ready to be trialed. And in fact, as we speak, I'm sure we are activating clinical sites, and we're on the brink of starting to recruit patients into our trial.
Right. When do you expect to have results?
Results the first half of next year.
Okay. As provided everything goes okay, and the timeline goes
yes, exactly.
early next year. And there has been some press recently suggesting that long COVID and other neurological conditions are related. What are your views on that?
It's concerning, of course. We won't know until the real data comes out in some years of what, the diagnoses of Alzheimer's and Parkinson's. But there is some alarming similarity in the pathology of patients with long COVID when they look in the brains. The pathology is similar to Alzheimer's. They're seeing signals there. There's changes in the brain they've documented. After COVID infections, the virus will infect neurons. It will affect the cells that produce dopamine that are important in Parkinson's disease. And, there was an alarming report just before COVID that the incidence of Alzheimer's, or the number of patients with Alzheimer's, was going to double by 2050, would double to about 13 million. And if COVID is going to increase that, if it's going to accelerate that pathology or create a population who are younger with dementia or mild cognitive impairment, that's concerning. And, we have to think about planning for that possibility as the data comes out that seems to support that it's a real probability. Yes.
Well, very interesting and absolutely right, concerning. So, Dr. Markham, thank you so much for sharing your insight. And we look forward to the results of these clinical trials with long COVID and see what kind of information they reveal. So, thank you.
Thank you very much. Thank you for having me.
Thanks. And I understand this trial is exploratory in nature, so we still don't know if it'll work, obviously, but you have to try. So how significant would it be if this would result in what you hope and think it might?
Yes. Well, first of all, let me underscore that this is exploratory in nature. So this is the first time we're testing bezisterim for long COVID. So we truly do not know what will come out.
Yeah.
Right. So I'm not providing any guidance on this, but I can dream on behalf of the 20 million Americans who suffer from long COVID. 20 million Americans suffer from this, and 3 million Americans have had such debilitating conditions that they've had to change their job just simply because they cannot keep up with the demands. Right. So that's a big deal. And if this trial works the way we hope it will, the first thing that we will do is go and have a conversation with the FDA to see if we can get emergency use authorization, to see if we can get this in the hands of these patients who have nothing out there, right? And emergency use authorization will allow us to help the patients while we conduct our confirmatory trials.
Yeah, interesting too that you mentioned the work productivity that's missed because of the economic impact is huge.
It's quite huge. It's absolutely quite huge. Right. So, for bezisterim, of course, this could be a significant drug as well.
Now, April is Autism Awareness Month, and you also have a connection to autism. Tell us about that.
Yes, my son was diagnosed when he was 2, right, and he's now 24.
Okay.
So I've been at this for quite some time, and along the way, I've helped start Autism Speaks. I've helped build a school in New Jersey, a K through 21 years old school for adults with special needs. I've created a foundation to train clinicians and parents on how to work with autistic kids. And currently I'm working with the Embrace program at Florida International University, where we're helping adults with special need build social skills, daily living skills. We help them to get a job, maintain their jobs, and so forth. And the thing that I've learned throughout this is that we are all differently abled. We have different skills. And by identifying and focusing on what each individual is really good at, you can actually help them lead quite fulfilling lives. But the key is focus on strengths, and don't worry about the deficiencies. That will work its way through.
Very interesting. Do you have any thoughts about HHS Secretary Kennedy Jr.? I mean, he's talking about finding the source of autism. What are your thoughts on that?
This is a very divisive issue. Right? There are genetic linkage to autism. There are environmental linkages to autism. There are quite a number of different things. I have my own hypotheses about this. I have a company that's working on this, right? But I think we just kind of need to recognize that there is a broad spectrum of autism. Because one of these days out there, I think we will come to recognize it's kind of like cancer. There are multiple forms of autism, just as there are multiple forms of cancer as well. And as a result of that, there are different ways to address it. Some could be a therapeutic, some could be a vaccine, and so forth. But I think science will help us understand more in due course. But we just got to keep with the science.
It's going to be very interesting, and I love your advice about focusing on what people are good at. So that's great. Thank you so much for coming in and updating us. And I know we'll talk to you soon when you get the trial results.
All right. Thank you, Jane, for having me back.